Hello, how are you? You probably already care about your health, try to eat well, exercise, stay well hydrated, but sometimes we end up forgetting about specific areas that we should clean in our daily routine. Some of these areas are obvious, and I hope everyone is already cleaning them properly, but there are others that aren't so obvious. Sometimes people clean them the wrong way or not often enough, and then it gets complicated because this can cause odor, irritation, infections, and can even put our health at risk. I'm going to tell you which areas these are and the real care you should take, especially if you're 60 or older. Stay until the end because you won't want to miss this. Before we start, I want to ask you, how old are you? Where are you from? What's the name of your city? And have you noticed as time goes by that your hygiene habits have changed, like the products you use or how often you do it? Has your hygiene routine changed for you over time? Write to me down below in the comments. I'd love to see your response. And remember to like the video, that really helps me out. And share it with anyone you think could benefit from this content. Help spread this chain of good. That's what I want here on the channel. The first area that always needs to be cleaned with great care and should always be remembered is the belly button. The belly button is an area that people usually forget needs to be cleaned, but it needs to be cleaned carefully. The belly button is a more humid spot, very protected, and it usually accumulates dead skin cells, sweat, and there can even be a certain skin microbiome living there. Many bacteria, right? Because when there's an excess of debris and excess of cells, that area can get inflamed and develop a certain bad odor. So it's important that we clean it, but in the right way, because some people take a cotton ball, a hard cotton swab, and rub it inside the belly button, and that can hurt the skin, which is often very thin. And then, since there was already a population of bacteria and dead cells there, it can become an entry point for infection and cause more serious problems for you. So, ideally, you should moisten a cotton ball without the hard stick of a cotton swab and clean with water and soap the part you can reach. There's no need to stick anything in. Don't stick your finger in there. Don't put anything inside your belly button because that can hurt or injure you. And ideally, you should dry these areas very well afterwards. The belly button should be thoroughly dried with a towel. And if there is pain, discharge, or a persistent strong odor in the belly button area, it's important to have a doctor check it as well. The second area is behind our ear. Many times people forget. They wash their hair, wash their neck, wash here on the chest from here down, but they forget to wash behind the ear. Our grandmothers already used to say that it's an area that should be well cleaned because there's a lot going on there, right? There's the sebaceous secretion itself. There's a buildup of sweat, dust, hair products, conditioner, and so on. So chemical residues from the skin can stick there, even bacteria, and they can cause a certain odor. So ideally, we should wash it with our fingertips, with a soft sponge behind the ear, or even with a cotton pad if you prefer. And always remember to dry that area where the ear meets the head, because people with seborrheic dermatitis might even need to use a specific anti-dandruff shampoo or some special lotion on those sides. It's better talking to a dermatologist about it. But you also can't leave this area too damp because that can lead to the proliferation of fungi. And we know that when the skin is cracked, the growth of fungi and bacteria can even enter the bloodstream, which can be dangerous for us. Another area that we should clean very carefully is the armpit. Of course, when everyone thinks about showering, they always think of the armpit because it's one of those areas that usually has a greater buildup of sweat and bacteria and already has that more characteristic odor. And the bacteria that are very present there often break down into volatile compounds, giving that very characteristic armpit smell. So it's super important that every time an elderly person takes a shower, or when you take a shower, you clean your armpits well. You don't need to use antibacterial soap, okay? That's a mistake a lot of people are making these days. Antibacterial soap doesn't just kill the bad bacteria, it also kills the good bacteria, and can even cause a kind of dysbiosis on the skin of the armpit. So ideally, you should shower daily with a neutral soap, and if you can, apply a moisturizer. Wear clothes made of breathable fabrics, cotton clothes, clothes that aren't synthetic, and don't trap heat there. Dry your armpits well after showering. Remember, if possible, to use a deodorant because it also helps with controlling the bacterial population and even with odor, which can be socially unpleasant. And if you notice that you have any kind of lump, any kind of pain in the armpit area, a very strong odor, or if any discharge comes out, it could be the presence of persistent bacteria. You might have injured the skin, formed a bacterial colony there, or even a pustule, an abscess. And it's important to consult a doctor because it's not common for us to feel pain in the armpit area, okay? So that's another important point to mention as well. Another area that should always be very well cleaned is the groin and the intimate region. That's because you can get intertrigo, which is an inflammatory rash, and you can also get a fungal infection due to moisture and friction, especially in people who are more overweight, in people who have a lot of skin folds. It can be a harder area to clean, especially if you're someone who is already at a very high weight and has trouble seeing that area. Remember that it's very important to wash thoroughly every day and to dry the area. If you have a lot of skin, lift the skin and dry it with a clean towel, just patting gently without rubbing or hurting the skin. Reduce friction, right? Wear cotton underwear, a more breathable fabric, and change your underwear every day or every time you shower more than once per day. And whenever your underwear is sweaty, even if you've already showered and aren't going to shower again, but your underwear is sweaty or damp, it's important to change it. It's also important to remember that if you keep getting chafing, there are barrier creams that can help control this friction, prevent chafing, and help the skin heal. There are some ointments with zinc oxide that can help you. For other more specific ointments, it's always worth consulting a dermatologist. And if this itching, if this redness persists, if you feel that there is any kind of unusual discharge or a sore that isn't healing properly, it's very important for you to seek medical treatment because it may be necessary to use an antibacterial or antifungal ointment and not just a powder or an ointment you buy at the pharmacy without a prescription. So don't let it get worse because for many people, since it's an area you sometimes can't see, once again, a large population of bacteria can develop there, even an abscess, and that can be dangerous for you. Another area that's very important to wash is your feet. Some people just let the water run over their feet in the shower, but remember to check your feet, clean between your toes, and dry those areas very well. Cracks and fungal infections between your toes can become an entry point for cellulitis, especially if you are diabetic or have vascular disease. It can be an entry point for a fungus or bacteria, which can even get into your bloodstream. So ideally, you should have a daily foot hygiene routine using warm water and a mild soap. Cleaning between your toes and drying them is very important. Moisturize your heels and the soles of your feet whenever possible. You don't need to moisturize between your toes since the skin there is already very thin. Always keep your toenails straight, trimmed, clean, and hygienic. And check your feet every day. Also, be careful with shoes that are too tight. If your shoes always give you blisters or calluses, that's not how it should be. Your shoes need to be comfortable for you. So, if you notice that you're having a lot of pain, redness, or red streaks, you should see a doctor to get help. And especially if you are diabetic or have diabetic neuropathy, it's even more important for you to pay attention to your feet because often sensitivity is reduced and the problems just get worse, right? And that's when the risk of a major bacterial growth comes in. And there are cases of people with circulatory problems who don't even realize it. And over time, they can end up losing their feet. Of course, that's a more serious situation, but unfortunately, it's not that uncommon. So remember to always clean and inspect your feet daily, okay? Tell me, was there any of these areas that you didn't really have the habit of cleaning as regularly as I mentioned? What are you going to pay more attention to next time you do your hygiene routine? I'd love to see your comment. Remember to like the video, it really helps me out, and share it with someone who will enjoy it or who needs it. Let's work together to spread this chain of kindness because that's what I want here on the channel. See you next time. Bye.